Okay, this is the case that we were filming video for. We're going to do a temporary complete denture, opposing to an arch that is very irregular, and we have these over-erupted segments here. Okay, we have this over-erupted. And I asked the student to place some indentation in the wax. عض أسنانك لورا. عض على آخر طحنة ورا. أيوة تمام. These indentations now are avoiding the over-erupted teeth, and we use the posterior teeth as stoppers. Okay, because the occlusion posteriorly is intact. The occlusal table is not interrupted. The interruption happened in the anterior area. So my question for the student, and why I'm doing this video, is I was asking the student, what are you going to do to take the bite? So this is the RCP of the patient. We have avoided the over-erupted teeth by placing indentation in the wax. We have checked the freeway space while the patient was speaking. عد لي من 1 ل 10. عد.
1 2.
Okay, the freeway space is sufficient posteriorly.
4 5 6 7 8 9 10.
You don't see it in the camera, but I've seen it in the posterior region and the anterior region. I have sufficient freeway space, so we have determined the vertical dimension correctly. Now, my question was, how are you going to record this and send it to the lab? What options do you have? Can I do it in wax?
No opposing.
Because the upper teeth are present, there is no opposing wax, so you were not thinking about the same ways we were thinking in when complete denture patients are there, because we have wax opposite to wax in complete denture patients. This is a single denture. So how am I going to take the bite? My advice to you is the following. We said occlusal rubber, but occlusal will come in and out, and it's very it's mobile a little bit. So what do I need to do? I need to take this out. How to do it? Okay, I'm going to take this wax rib out. I'm going to ask you to make some indentations, grooves. A groove here and a groove here. These grooves are orientation grooves. If the wax comes out, if the rubber comes out, the occlusal, I could put it back and orient it back.
Like a V shape?
Like a V shape, a small V shape. So heat this instrument.
Okay.
While it's very hot, put it inside. Just do like this and this. It will become like a V shape. So one here, and another 2 here. Okay. My second step for the rubber not to come out when I take the occlusal bite, because this is the occlusal, it's a type of rubber, and rubber does not adhere to wax. So you're going to dry this, wash it very well, dry it maybe with alcohol if you like, or soap, so no mucin is there, no remnants of saliva is there, and then apply rubber adhesive. Do you know the adhesive that we use for trays in rubber impressions? The same adhesive. So apply over the wax, paint on the rubber adhesive. Okay, allow it to dry it very well until it's very tacky, and then take the occlusal bite. So what will happen? The rubber will go into the indentation in case it dislodges from place, but the adhesive will keep it in place. Now the rubber is here, the other upper teeth are biting in the rubber, so I'll have the indentations of teeth, so the technician will know how to orient it. But before doing all of that, recheck your RCP. Suppose use one of the teeth as a guide. Suppose this is the canine, upper canine. Put opposite to the canine tip a mark. Opposite to one of the molars a mark. Wherever you find a prominent cusp that you can see buccally, put a mark, and once you do the rubber bite, recheck the open the mark and see if the mark is still opposite to the same cusp, to verify that you're still in RCP.
حطيت على الكناينز وعلى الميدلاين.
Okay, you have done midlines and canine lines, but usually the technician don't follow them. They follow the natural teeth actually. Okay, they want to harmonize your midline and canine lines with the teeth present, so they might alter them. So the canine line itself is not an indication. In the complete denture patient, even in the complete denture patient, we're using canine lines and midlines where? In the upper mostly. Here we have natural teeth. They are interrupted. They are over-erupted. They have disrupted by periodontal infection that is going on, and we need this temporary complete to finalize the periodontal status of the upper and decide which teeth we're going to extract, which teeth we're going to keep. So what are we going to do in between? We're not going to use the canine line actually. I'm going to use the cusp tips of some teeth that I could see. It might be the canine, maybe another tooth. It depends on which teeth I have present. So this is how we take a bite for a single denture with an interrupted occlusal table against it. Okay, so we open the window wherever we have erupted teeth. We use the posterior as our guide for freeway space and measurements, and the occlusal stops are present on the posterior, and then we're going to do occlusal with an adhesive and grooves in place. Okay, thank you.